Owner of Vivian Physical Therapy, host of the Servant PT podcast. I help women 50 and over live a life full of health, family, and fun. So yesterday, got this question from one of my dear friends, Denise Gildon, and asking, basically, is there any hope or is there any treatment for someone with severe spinal stenosis? So I'm going to answer that question just as soon as I share this on a couple of other things. So give me just 1 second and I will let y'all know what's going on. And so, is there any treatment for severe spinal stenosis? So the first question I have is, what constitutes severe spinal stenosis? Okay, lower spine. Perfect. We'll talk about the lower spine. So the lumbar spine. What constitutes severe spinal stenosis in the lumbar spine? Well, let's first talk about stenosis. So stenosis is just a narrowing of the spine. So we'll think about in your spine, the nerve goes through. Let me make sure you can't see what's on the other side of this. Hang on. Okay, that's got somebody's name on it. So the nerve goes through a hole, okay? Right. I can't draw at the same time. So the nerve goes through that hole right there, and that's where, that's called the foramen. It's just on the side of the spine. That's where the nerve goes through. So all spinal stenosis is you take that hole right there, that foramen, and then you make it narrow. So you do something to narrow that hole, okay? So that's where the nerve goes through. So that can be done by a bone spur. It can be done by a disc bulge. It can be done by tight muscles. Well, kind of. Let's just talk about bone spur and a disc bulge. Tight muscles can be different. You know, if you're used to being hunched over, then that could tighten up and that could cause it. So let's talk about bone spurs first. What can we do for a bone spur in the foramen or the hole where the nerve is? There's not a whole lot we can do. There's not a whole lot I can do because I can't go in and physically take that spur out. Now, obviously, that's what surgery's for. We'll talk about that in a little bit. I'm trying to keep this under 10 minutes, but I'm probably not going to. So if you have a bone spur, possibly surgery. Not guaranteed. You don't have to. So let's talk about a disc. If the disc is bulging, so a disc can bulge straight back onto the spinal cord itself. It can bulge to the left or to the right onto the nerve. So we kind of think about the vertebrae like Mickey Mouse, okay? So Mickey Mouse, that would be where the spinal cord is here, and then the foramen would be on each side. So the spinal cord goes down the middle, and then the foramen are here and here. So if the disc goes back onto Mickey's face, then you're going to have problems on both sides because we're going to be pinching on the spinal cord itself. If the disc bulges to the left or the right, then it's going to be on that nerve. Okay, so this is kind of dark. That's a little bit better. So if the disc bulges straight back, then you're going to have symptoms going down both legs. If it bulges to the right or left, you'll have symptoms on right or left leg. What can we do about that? Okay, if it's a disc bulge, there's a ton of things we can do. First off, if we decide which side it's bulging, left, right, middle, then that directs our treatment. So we do exercises to take the pressure off the nerve. And if you have a disc bulge, a lot of times sitting is going to be worse, okay? Bending over is going to be worse. Sleeping, possibly on your back, is going to be worse. Things like that. You're going to not want to change positions a lot. Riding in the car is going to hurt. You're going to have pain in your legs. You're going to have to get out, walk around the car, take breaks, stretch, things like that. So that can be a disc bulge. Hang on. So that would be for your disc. So the way we treat that is by extending your back. And so a lot of times people with disc bulge for stenosis say standing feels better. Leaning back feels better. Sleeping on my stomach feels better. Things like that. Things that extend or elongate your spine. Okay, so that's what we can do for that. let's talk about a little bit more on the disc. Sometimes people have what's called a lateral shift, where you're supposed to be like this and you're kind of shifted over. And you'll see people walking kind of crooked. They'll be shifted away from that pain. And so initially we have to fix that lateral shift, but then afterwards do the same thing. We'll put those people into some extension or standing up or leaning back, doing press ups on the floor in the bed. So this is something that we treat all the time in physical therapy, and we keep people from having surgery all the time. I've seen so many people over the last 9 years who had this, and we were able to do some things for them to keep them from having surgery. Okay, so let's talk about the second thing, stenosis due to a bone spur. Okay, so the bone spur can be same thing as the disc. It can be right in the middle, right on Mickey's face. It can be on Mickey's ears, however you want to look at it. And we'll also see the same corresponding problems: left leg pain, right leg pain, bilateral or both side leg pain. What do we do for that? So I've already told you I can't remove that bone spur without doing surgery. But the good news is we may not need to. So I've seen a ton of people over the years that had a bone spur, and we were able to work on them and get them better and help them feel good. So what do we do if we have a bone spur? What do we see? Well, we see standing feels worse. It hurts to wash dishes. You go to Walmart and you can't shop without holding onto a shopping cart. People say, I can go walk for an hour, but I have to lean forward. So bam, hey, probably I got a little stenosis. Or it feels great when I sit down. I don't hurt at all when I sit. Okay, well, possibly you have a bone spur, and that's causing your stenosis. So there's a lot of things you can do. First thing, and the most important thing to do, is figure out which direction we need to treat you in. And so, like I said, you're either going to be forward bending is going to make it worse, or backwards bending is going to make it worse, or forward bending to the right, or forward bending to the left. There's ways to figure out which motion it is. And 9 times out of 10, when somebody comes into the clinic and I'm evaluating them for this, while we're talking, I'm watching how they sit in the chair next and across from me. And when it's all said and done, I'm like, oh, okay, well, so leaning to the left and lifting your leg up feels better to you, right? And I'm like, oh, yeah, how do you know that? I'm like, well, because you've been sitting like that for the last 15 minutes while we've been talking. So kind of pay attention to how you go throughout your normal day and what feels better and what feels worse. And that's what I try to tell people is like, if you're standing at the sink washing dishes and your back pain starts and then your leg pain comes on, well, then standing at the sink washing dishes is something that aggravates your pain. And so then, go ahead and stop that immediately as soon as that leg pain comes on. And then later, when you go back, because you're probably going to have to wash some dishes late, again, figure out what was causing it. So maybe if you were standing up washing dishes and standing all your weight on your right leg, maybe try to shift a little of your weight to your left leg or lean to your left side. So another thing we don't think about is when we're standing, a lot of times people aren't standing symmetrical. One leg is, you're putting more weight on the left leg than the right. And it's really cool to point that out to people because they're like, their mind's kind of blown, like, what are you talking about? But, a lot of times you're doing that. You're shifted your weight one way or another. And that's something that's really simple, but that might make a big difference. So anyway, so if you find yourself and you're washing dishes and you're hurting, well, pay attention to how you're washing dishes. If you are sitting on the couch watching, the latest Netflix show that you're going to watch 17 hours on a Saturday, and you start hurting hour or 2 into it, figure out what you're doing. Are you slumped down in your couch? Do you have your feet propped up? Do you have your legs crossed? Are you laying on your side? Are you laying on your stomach? Are you having to look up to the TV? Are you looking down? Are you looking to the side? These are all things that we take for granted. Like, well, I was sitting on the couch and I started hurting. Well, how are you sitting on the couch? Listen to the last 10 seconds. You'll figure that out. So we have to constantly be thinking about these things. And that's the cool thing about what I do is like I get to pull this out for people. Well, Miss Denise, how are you sitting? How are you walking? Did your chickens jump on you while you were doing that? Does it hurt when you go outside and collect your eggs? Does it hurt when you clean your coop? Does it hurt when you do yoga? Does it hurt when you work at the bank? This and that, things like that. So when are you hurting? That's the biggest thing for us to show you how to stop hurting. And I don't hear this. So a ton of PTs, I used to say this myself. I've heard PTs say this before a long time ago, and I used to say it is because I didn't have anything better to say was, Hey, I have to make you hurt on the first visit, so I know how to make you feel better. That is so horrible. I haven't said that in years, and I don't try to do that anymore. Absolutely not. I try to figure out what makes you feel better, and I can usually find out what makes you hurt just by listening to what you say. I don't have to make you do all this crazy stuff. Am I going to get you up and move around? Yeah, absolutely, but I don't have to. From a car wreck, I think. So, yeah, so you may have a car wreck. So possibly, you may have some calcium buildup, which is what bone spurs are. They're called osteophytes. If you see that on an x-ray or something, osteophyte formation, calcification, all of that's just a big word for a bone spur. And so, that could be causing that. You could have some arthritis. You know what arthritis means? Aging bones, inflammation of the bones. It's just an aging process. We're all aging. I posted this last week about degenerative disc disease that one of my friends posted. It's basically like wrinkles on your forehead, and it absolutely is the truth. I know a couple of people didn't really like that post, but the truth is degeneration is aging. We're all degenerating. Look at my hair. I'm 36. It's gone. It's degenerated. It's not a life-threatening disease. So a lot of times we can make these things feel better. Maybe not go away, but we can make them feel better. We can adjust kind of our body by getting stronger, getting more flexible, nutrition, eating better, drinking more water, and just learning how to move in ways that don't cause our pain. And notice I didn't say stop doing anything. I'm not telling you to stop. I am a firm believer in helping people continue doing what they want to do. Now, whether that's gardening or running or bicycling or yoga, you're never going to hear me say, well, I'm not going to say never. You're not going to hear me say very often you need to stop doing X or don't do Y ever again. You're going to more than likely hear me say, let's figure out how we can get you to keep doing that. Because I don't want to live without being able to play with my kids. I don't want to live without being able to spend time with my wife and go to the movies like we did last night. And I would say most people don't want to live without doing the things they enjoy. So we just have to figure out what is causing the stenosis first. So what's the cause? 2, which direction makes you feel better? 3, what do you want to continue doing? 4, what things aggravate you and how can we adjust those to stop aggravating? So there's 4 things right there. Cause, direction, what do you want to do? How can we adjust it? That's it. That's how you treat it. That will treat severe stenosis, mild stenosis, things like that. Let me tell you something. There's more and more research coming out every day that talks about medication. It's not doing anything for us. Pain medication. It's harder and harder to get things like tramadol, oxycodone, Lortab, which is great because they're not helping people. They're just masking. They're making you look drunk and feel drunk. They're just making you spacey. And so we know there's no doubt on this planet that those things do not help us like they're supposed to. Do they take away pain? Absolutely, they sure do. But you know why they take away pain? Because you don't feel anything. That's it. And so we know as physical therapists, personal trainers, athlete trainers, chiropractors, we have the best thing for you. Exercise. That's it. That is the best drug we have, is exercise. It releases endorphins, chemical. There's a natural pain reliever right there. There's a natural mood enhancer right there, endorphins, exercise. We have certain parts of our profession that help people with nutrition. If you're a woman and you need help with nutrition, you can look for my friend Lisa Lou Fitness, Lisa Arndale. She's here in Bossier, and she would love to help you. She's got so many ways that she can help you on Facebook. And I'm going to mention another one that's local to Vivian just a second before somebody calls me out on it. But there, she does meal plans, weekly meal plans. They do meals, they deliver all that stuff. And then if you're local to Vivian, North Caddo area, look at Danielle Bain, Tiny's Meal Prep. She will bring the food to you. There's several locations locally to Vivian where you can get good, healthy food that you don't even have to make. You just got to pay. I think it's $8 a meal. This is a cheap promo for Danielle. So, there's ways that we can get healthy. And it's not through drugs. It's not through, look, there's a time and a place for surgery all all the time. I mean, all the time. There's a time and a place for surgery, absolutely. But it's not every single person has back pain. It's just not. It's not every single person has neck pain or shoulder pain or knee pain. There's so much research coming out now, and it's years old. It's not like it just came out. It's not getting a lot of publicity because the people that give medicine and do surgeries aren't pushing it, and they're the ones with most of the power because they got the money. So, it takes eggheads like me to say, "Hey, this is not good." So, I want to ask you a question. Whoever, Miss Denise, whoever watches this later, how many good outcomes have you heard from neck and back surgery? I guarantee you, there's not going to be a whole lot. Now, there are some absolutely phenomenal spine surgeons in our area, and I refer patients to them. I absolutely do. And I see patients with neck and back surgery and shoulder and all that stuff. I'm not saying it's not needed, but I'm saying let's try some other things first for treatment. And exercise, diet, yoga, Pilates, whatever you want to try, whatever you enjoy. What's the most important exercise you can do? What's the best exercise you can do? The ones you enjoy. The 1, 2, or 3 exercises you're going to continue doing. Is that yoga? Is that Muay Thai? Is that Pilates? Is that Zumba? Is it refit? What is it? It doesn't matter. Just do it. We know now that we used to do all these perfectly programmed lumbar stability or low back stability exercises. Core strengthening is the dumbest word. It's just everybody just stamps that on everything just to make you think you're doing something. We do need to strengthen our core, our abs, our low back muscles, but we know that just being active and just exercising is 9 times out of 10 enough to get your back stronger. So with all that said, that long-winded 17 minutes that I've been talking, I just want to say that if you are having some severe stenosis, if you have been diagnosed with a disc bulge or a disc prolapse, or if a doctor has told you you have the worst bone spur they've ever seen, I can tell you right now, I've seen a lot of patients with shoulder surgeries, knee surgeries, back, neck, whatever, over the years. And I would be willing to bet that I've heard over 50 times a patient say, the doctor told me I had the worst bone spur they've ever seen. Some of those were from the same doctor. and some of them are doctors I love. That one doctor in particular, I love the doctor. Love their patients. They're great, but it's like not everybody has the worst bone spur they've ever seen. And maybe like me, sometimes they just don't know what else to say, because I'm sure it was bad. But there's a lot you can do for severe stenosis. There's a lot you can do for disc bulge. There's a lot you can do for sciatic nerve pain. There's a lot you can do for degenerative joint disease, arthritis, commonly known as aging. So if anybody has any further questions, that's a long video. I really don't expect very many people to watch it to 18 minutes. But if you have any questions, please put it in the comments. I'll be glad to answer them probably tomorrow, because hopefully my wife and the kids will be here in just a minute. I'll get back to working. Get back to spending time with them. But there's a lot of options for stenosis, back pain, and it doesn't always have to be a lumbar fusion or whatever else they're going to do. There's some back surgeries and neck surgeries that aren't that complicated, and then there's some that really, really complicate life. Just from my experience, I've heard so many people say, well, I couldn't do, yes, ma'am, you're welcome. Sorry I got long-winded. I hope that answered your question. If you have any more questions, call me, 318-278-0330, or, send me a Facebook message, no big deal. Or we can talk later in the week. But there's a lot of people that have that had surgery that say, look, I hurt a lot before surgery, but I could do anything I wanted. Well, now I still hurt a lot, and there's a lot of things I can't do. And that's not really funny. And I had that conversation with somebody just this week. So be careful. If, anytime I recommend, and I've heard a lot of orthopedic surgeons say this, if somebody recommends surgery, go get a second opinion. It doesn't hurt anything. If I tell somebody something they don't agree, I'll always offer them a second opinion through me calling a friend of mine, or sending them somewhere, or telling them where they can go, or letting them pick their own place. If you're having something done with a medical professional and they don't want you to get a second opinion, then absolutely go get one, because they have do not have your best interest at heart. I don't think so. Guys, I hope this helps. Hope this helped Miss Denise. I hope this helps some other people. But if you have any questions, please put it in the comment section, and I will answer it first thing in the morning. Thanks, guys. Have a great rest of the day.